Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos. Hello, I am Dr. Jones, and I want to welcome you to our first episode of Breaking Down Mental Health with Dr. Jones. I hope this video will be something that you enjoy. If it is, please don't forget to like and subscribe and hit that notification button so you can see when we put out new content. Well, we are in 2021 and we are still in this pandemic, but we're starting to come out of it. And so today we want to talk about telemental health counseling during a pandemic and some of the lessons that we have learned this past year. And so I want to spend some time today looking at some of the lessons we learned and where we're going because of these lessons that we've learned. One of the first things we learned this past year that mental health professionals were unprepared to shift to online work. Now, that may be a little bit shocking of a thing to hear, but one of the main things we saw going on this past year is that if let's go back 10 years or so, right around 2010, when we saw a somewhat of a rise of people using telemental health counseling, but it seemed to be a fad at that time period. And so not everybody was jumping in and getting on board with using telemental health counseling. And so we fast forward to 2021, people's businesses are closing down, people are needing to get mental health counseling, and now you see a flood of people coming in trying to get trained to do telemental health counseling. And so because of this, you saw people getting trainings from all over the place trying to get prepared to do telemental health counseling. And so this became a shift that many people just had to do because they wanted to stay healthy and they wanted to keep their clients healthy as well. But we overall, as a profession, we're not prepared for this because many individuals did not have any training at all, or maybe they did a crash course or something to that nature. But being ready for this pandemic was something that not everybody was ready for, and so we learned that we need to be prepared for it. And so now that we're in the midst of it, and hopefully getting towards the end of it, we have learned that there were some things we should have been preparing for years beforehand. So we've been ready for this pandemic when it hit. Something else we learned during this pandemic is that the counseling office took on a new meaning. We saw a lot of people shift from having a traditional office space in a building. Now we're seeing people who have shifted to videos and doing their videos from home. I've seen people convert their closets into office spaces, or bedrooms into closets into office spaces. I've even seen people use their ironing board as a place to see clients as well. And so we saw this big shift and this big change during this pandemic time, that the counseling office just looks different from what it ever has before. And so the question we're still trying to figure out is, how much longer will we continue to do this? Much longer will the counseling office be different and change because of this pandemic? And will we ever go back to what we consider a normal counseling office? And so a lot of people have transitioned online, therapists have transitioned online, the clients have as well. But there are still some people clamoring to get back into their office spaces because they're paying rent on those. And so the office is going to take a new look from this point forward especially because of insurance, many of them will only pay for services that are in office spaces that are designated as such. And so when people are shifting to their home as a home office or to a closet, or whatever the case may be, that became a problem for some people. So the counseling office just looks different now. So we're going to see what that's going to look like and how this continue to change over these next few months. Something else that we also learned last year or throughout this pandemic is that digital eye strain was at an all-time high. I think in general, people were already on social media and on their mobile devices already enough as it was. But because people were doing a lot more counseling cases online, you see people coming away with headaches because of the blue light that was coming from their screen, and it was causing problems for them. And so it became a health concern for many health professionals because they were finding themselves still trying to keep the same type of caseload, but doing it primarily from a video-based source, and because of that, they end up harming a lot of people's eyes, and that became an issue. And so these blue blocker glasses has been something I've seen been very popular for people this past year, is that they've been using those to help with some of the digital eye strain. But once again, this has caused some health problems for practitioners. And so we've learned that doing video-based counseling all the time, there are some issues that we're finding with it. It's still a good way of providing services, but what I think that we need to consider it and realize that we did learn that this did cause some health issues for practitioners. Another thing that we learned this past year is that we did not have an adequate infrastructure to provide counseling. I live in a rural state, and so we still have people throughout the United States who are using dial-up services in order to connect with their providers. And this has become very problematic because not everybody has has a fast Wi-Fi speed. That not everyone has the ability to be able to connect to something that's a fast speed. And so you saw people shifting to doing some text-based counseling, some people doing phone-based counseling, but this didn't always work for everybody because once again, the structure was not there. And the ability to find somewhere where you can do counseling services in a private manner became very difficult because once again, the infrastructure of having a very fast connection speed was not something that everyone had access to. And so we saw that this infrastructure was not there, and this is something that has to be continued to be worked on so that we can provide services during this time period. Another thing we learned this past year is that burnout was inevitable without purposeful self-care. In the mental health field, we've always talked about a burnout. We talk about self-care. Those are two things that come up over and over again. But the problem we're seeing that many people were burning out quickly during this pandemic. And the reason why they were burning out is because they didn't have the time, or they didn't take the time to provide the type of self-care they need. So maybe normally I was used to seeing 8 to 10 clients in a day, or maybe 6 to 8 clients in a day, but sitting in front of a computer all the time, I couldn't maintain that caseload. And so you saw people having to either continue to do it that way, but burnout became at an all-time high from that. And so that obviously is problematic for individuals when they're having to see a large number of clientele through video services. And once again, with the eye strain, not being able to take off, not being able to get out the way they used to, we saw burnout become an issue and continues to be an issue. And so we learned that during this pandemic time, in order to not burn out, we had to be purposeful about self-care. We had to be purposeful about taking time off and doing things that we need to do and just being able to shut off. And that's hard for a lot of people. A lot of people don't enjoy having to shut off, but it is obviously very helpful so they can have that time and ability to be able to tend to family, attend to the activities they have, be able to participate in hobbies. And so we, once again, learning how to find that balance where we weren't burning ourselves out from work became a very difficult thing during this pandemic. Another thing we learned this last year is that returning to a traditional office setting may not occur for many, or may not occur anytime soon. Depending on what state that you're in, every state has some type of restrictions they have when it comes to seeing clients. In some states, some individuals actually continue to see clients face to face, 6 feet apart with masks, and then they were sanitizing in between sessions, doing a lot of hard work in order to be able to maintain their caseload and get their clients' needs met. They needed to do it in the way they needed to. But then you also have individuals who were not able to return to a traditional office setting because it was just something that was not viable for them, and they're still not able to do that. And so that has caused some problems for some practitioners. One from a financial end, if I'm still having to pay rent for a place that I'm not using, could definitely be an issue there. And so right now, going back to a traditional office space may not be something that an individual is able to do, but once again, they're still trying to figure out a way to provide services for their clients. And so this is a lesson that we learned, and one that we're still trying to work through as well. We also realized that this modality is not a good fit for some clients and for some practitioners. Now, if you know me at all, when it comes to telemental health counseling, I love telemental health counseling. I love teaching about it. I love practicing it as well. But one thing I've talked about in my trainings, I've talked about many times before, is that when we talk about telemental health counseling, it is not for everybody. So it's one thing for me to say that. It's another thing for us to actually see that happening in the counseling sessions. That some people, when they got onto the telemental health and they actually start practicing it, they realize it just wasn't a good fit for them. They liked having their clients in the office with them, with the way they were traditionally trained. And so that became a problem for some clinicians that they just did not want to switch over. And so even though they still continue to do it, it's not a good fit for them. And then for some clients were figuring out that this wasn't a good fit for them either. That whenever it came for them to be able to process and to do the thing they normally did in a counseling session, it was just different and different enough that it didn't really fit with them. Now, I don't say this to say that telemental health is not a good thing. Obviously, I'm a big fan of it, but we are seeing that this modality is not a great fit for some clients. It's not a great fit for some practitioners. Now, for some people, they love it, and some people actually have decided they're going to go 100% telehealth from this point forward. They're never going to return back to an office, and I'm excited for those individuals. But I am hearing from a lot of clients who are saying, man, I can't wait to get back into the client's office and into my counselor's office because that's where I feel the most safe. And so we do have some mixed reviews out there when it comes to this modality right now. And once again, knowing that it does not fit for everybody. And so it is effective. It's just as good as face-to-face counseling. But once again, it's not always a fit for everybody. Also, we realize that there remains a training gap for new professionals and students. I say this is because when we started seeing, I would say roughly around March of 2020, when it really started to hit pretty hard here in the United States, a lot of universities did not know what to do with their students when it came for them to start practicing their practicum and internships. And so they didn't know how to get them trained. And so you saw some universities where they would do a 30-minute training, and that was all the students had in order to be able to practice. Some went with 6-hour training, some went with 21-hour training, some went with 15-hour trainings. But the problem is there was no consistency across the board for students or for professionals. So we still have individuals out there where they're practicing telemental health where they've had no training at all whatsoever, because sometimes there have been some states where the governors mandated, hey, we want practitioners to reach their clients, we want telemental health to be used, which I think is a good thing, but these individuals are not practitioners themselves. They don't know what the nuances of what we do, and so they open up those floodgates. And so because of that, there were a lot of individuals who jumped into this space, but they've not been trained to do that. And so we still have a training gap that needs to be met, because right now there's not a set standard when it comes to telemental health training. We are all over the place when it comes to the amount of training we have for telemental health. And so hopefully we're going to get to a place soon where we have a standard training where when a client logs on, they know that the therapist they're working with has gone through a certain amount of training, that there's some accreditation behind that, there's some standardization behind that as well. And I think that's going to help the profession in a big way. And so we just learned it with that training gap was present. Also, we started to see that practicing across state lines is not easy to maneuver. We saw that the Department of Health and Human Services, they removed a lot of restrictions for individuals to be able to practice across state lines, which I thought was a very appropriate thing to happen during that time period. The issue that became a problem in all of this was that sometimes individuals end up picking up clients in new states, and as these states have now started to back off on allowing those practitioners to counsel across state lines, now you have those clients who have built a relationship with a therapist. They have spent several months with those therapists, and now they're having to find someone in their own state because those clinicians are not licensed in those states. And so that is something we're continue to maneuver through. Another thing we're seeing with that too is that when we see crisis come up in these other states, the research that people are having to do to make sure their clients remain safe, it becomes problematic. Finding the local mental health clinic for those clients, knowing how to get in touch with the hospital, the doctors, the person of care for that individual. All this gave a lot more homework for the therapist in order to be able to provide counseling across state lines. And so we saw that this was not as easy as some people thought it would be. And so I realized there are several people who have practiced across state lines and do it on a regular basis. And I think some individuals do it really well. But I think that one thing we really learned is that it didn't work out as well for everyone as we thought it would. And so hopefully we'll start to see some things change in that manner. Also, we realized that managing a 100% online practice comes with challenges. There are individuals who do practice 100% online and they do it well. And so if that's you and you fall into that category, awesome for you. I think that's a great thing. But we did see a lot of practice owners find themselves in a bind when they were doing these online practices, because it wasn't something they were trained or ready for. It was different when we were in the office and they're doing their office meetings together, when it came to doing trainings for staff and things of that nature. All those things was normal for them inside the office. But once everything went online, it became a little bit harder to keep the community together when it came to employees and making sure everybody worked together well. That became a strain somewhat. Also, when it came to scheduling as well, that became a little bit more of a harder thing to do, because now you have people who are at home and they're trying to balance a family and work and all being in the same household at the same time. And so we saw that this became a little bit harder to manage. So it wasn't impossible, but it did become a little bit more harder to manage that during this time period. And so that was another thing we learned during this pandemic. Also, tracking insurance company policies became a major headache. We saw many insurance companies throughout this pandemic who would jump quickly on allowing people to provide counseling through telemental health, and people were able to get their reimbursements just like they did if they were seeing a client inside their office. The problem was, depending on what insurance company it was, sometimes those insurance companies had different policies underneath that. And because of that, you will find yourself calling these insurance companies on a monthly basis, finding out, when is this going to expire? Are you going to stop paying for telemental health counseling and things of that nature? And that, for practice owners or for those individuals who are trying to do the billing and verification of benefits for clients, that became a major headache. And so we're seeing hopefully a little bit of stability with that going on right now. But overall, that was a big issue that we saw going on. So we're hoping at some point we can get things on track with insurance companies where everything is just taken care of from the get-go. This is not something that we have to continue to go back and deal with, but we're still not there yet. Another thing is that we saw is that clinical supervision had to take a major shift due to technology. Depending on the state that you practice in many states, they were not allowing you at all prior to the pandemic to be able to practice to provide any clinical supervision in an online environment. Some states were allowing you to do it, but they were saying only half of your supervision could be done that way. Well, when we're in a situation where you can't really be around people and you had to have that social distancing had to happen, you saw a lot of people having some difficult time trying to be able to do that. And so you saw these clinical supervisors providing telemental health supervision for their practitioners, but then trying to find the right platforms and forums so that everything they did was HIPAA secure and they did it in a HIPAA compliant way. And so that became a big issue for clinical supervisors during this past year, is figuring out, how do we manage and how do we monitor our supervisees we're working with now that we're in this pandemic and I can't go and be in a room with them or be in the same clinic with them while they're practicing. And so that was something that we had to work through, and we had to learn some lessons there. Also, working with children and adolescents became a little bit more challenging. Now, once again, I'm not saying that this was impossible. What I am saying that it did become a challenge to be able to work with children and adolescents, because especially if you were in an area where you're used to seeing a client in session in a room, in a traditional counseling room, you provided play therapy and things of that nature, and now you're having to do it over the phone, which I heard from a lot of clinicians that was some issues that they dealt with. It was very hard for them to keep a session going longer than 15 to 20 minutes because If the child's on 5, 6, 7 years old, and here I'm on the phone with them, the child is showing them everything inside their house. There's a lot of distractions there. The kids really could not get to the point where they were able to really engage with the therapist. And so, yes, they were meeting with them, but a lot of therapy was not happening. And so, once again, it wasn't impossible, but it did become more challenging during this pandemic. And so, that was some things we saw individuals struggle with as well. So the final question we want to try to answer here is, where do we go from here? As we are trying to get back to some semblance of things being normal, as we're trying to get to a place where some people are trying to transition back to the counseling office, where do we go from here? One of the things I hope that we see happen during this is that more insurance companies, especially if you're insurance-based practices, will start paying for telemental health counseling without there being restrictions on it. And I think that's something that I hope that we see happen in this next year or so. I think it's very frustrating for a lot of practitioners out there when they're having to check over and over again to see if their sessions are going to be covered. It's causing more stress and strain for them just to be able to provide service for their clients. And so hopefully insurance companies will get to a place where they would just say that telemental health counseling is paid for. There's not a restriction when it comes to how often we can do this. There won't be restriction on the area of location where we can provide these services for. And I think that's something that we look forward to happening one day. Another thing I hope to see come from this is that at some point that we'll get to a place where counseling across state lines becomes easier. That one thing that we saw, that if I'm licensed in one state and my client's in another state, it caused problems, it caused issues. And so hopefully we can get to a place where it won't make a difference where the client is located at the time of the session or where the therapist is located at the time of the session. And those things can get worked out so clients can maintain their mental health and the counseling they're used to getting regardless of where they are at the time of that session. Obviously, no, that still needs to be done in an ethical manner. Obviously, we still want there to be verification processes done for the client. But I think we want to be able to hopefully be able to broaden out and not have a situation where clients are having to stop therapy because they've gone out of town or because the therapist is going out of town. And so hopefully that's something new that we see that comes from this as well. And then finally, I hope from all these lessons we learned, I hope that we can get to a place where we can just have a standardized training where we know that these are the things that you have to know if you're going to practice online. So that when students graduate from their master's program, they have training already in telemental health counseling. If you're brand new in the field, you've been trained already, and you have that under your belt. So this does not become a difficult thing. Because I realize at some point we will be back in offices. I realize at some point we will be through this pandemic. But if someone has not, for these students who may be just starting in programs and they're graduated after the fact, and they graduate at a time where we're not in a pandemic, they need to be prepared and ready to do telemental health counseling. Because the reality is we don't know what the future holds. We don't know what things could happen. And so we may be in a situation like this again in the future, and we need to be ready for it when it happens. Well, I hope this video has been educational for you and helped you to see a little bit of some of the lessons we've learned this past year. I know I've enjoyed this past year, at least from the research piece of it, being able to see how people have been maneuvering through everything. But I hope this video has been helpful for you as we are still trying to figure out some lessons from this pandemic and how we're going to go about and dealing with them as we try to transition back to any sense of normalcy. Thank you so much for watching. Once again, if anything in this video was helpful for you, please don't forget to like, subscribe, and also hit that notification button. Hope you have a great day.